Hello everybody, I'm back with a very exciting topic. Last time when I talked about caffeine and fat oxidation and some of the comments I heard that I left on a cliffhanger, and I did not get into how you could synergize the mobilization of fat with caffeine and the oxidation of fat that enhances with exercise, and how we can put these concepts of fasting in an exercise state along with caffeine and exercise to optimize our health. There is a term in medicine which is called additive versus synergistic. Additive is simply adding 3 plus 3 and saying it is 6. And that's not what the combination of fasting, exercise in a fasted state, and caffeine does. In other words, its effect on oxidation is synergistic. Before I go too far, I would like to say that I really like what I do. I feel relevant in giving this information to you. And I'd like to become more and more of a physician, a healthcare provider who's counseling patients to optimize their health based on lifestyle changes, based on evaluating their insulin resistance, their inflammation markers, their cholesterol quality. And I would like to do less of the general cardiology work that I have done for the last 30 years. So I would like your help in spreading the message that I am a part of IDM Houston, that we have a brick and mortars as well as an online fasting clinic. So you could get counseling from me and my associates by going to the fasting method website, by going to the IDM method website and booking a session with us. And I'd please like you to give me a thumbs up, to share, subscribe, so that this channel gets better visibility. Before I can answer the question as to how caffeine and exercise work together, I first got to deal with the important aspect of how exercise enhances insulin action. Insulin action means that insulin is signaling better to store sugar, to make new protein, to improve our brain function at a lower insulin level, and that is called insulin sensitivity. How does exercise help us achieve that? This is a study in 7 young men. 7 of them were trained endurance athletes, the others were sedentary. And this is looking at their age was similar, their body weight higher in people who were untrained versus people who were trained, their body fat percentage about 12 versus 18%. So the body fat percentage was lower with training. Their resting metabolic rate was higher in the trained individuals when you looked at total body mass. But when you looked at lean body mass, it was similar. So quickly summarizing this data, endurance training, especially in young people, is likely to reduce your weight, reduce your body fat percentage, and increase your resting metabolic rate. Now, when they subjected these individuals to a glucose tolerance test like Dr. Joseph Kraft had done, Dr. Kraft had not just measured the response of increase in sugar to a glucose load of 100 grams, but he had also simultaneously checked their insulin levels. So when a glucose tolerance test was done in response to 100 grams of glucose, and these individuals were not diabetic or had impaired glucose tolerance by the classic definition, so their glucose levels pretty much remained the same. There was a little bit of divergence towards the end in which the untrained subjects had slightly higher sugar levels. However, if you looked at their insulin, the insulin level was dramatically lower in the trained subjects compared to the sedentary ones. And when you looked at the total area under the curve in terms of the picomoles of insulin that was produced over this insulin and glucose response curve in response to a sugar load, we found that the trained people had to make less insulin. What that means is that exercise training improves insulin sensitivity to the degree that you need less insulin to keep your sugars in control. Now, they went further and they kept these individuals in a sedentary state for 90 minutes. They were just lying down for 90 minutes. And they checked their insulin level every minute for 90 minutes. That's fascinating. They checked insulin levels every minute for 90 minutes. And this is a couple of representative insulin curves over the 90-minute period. And what you see in the untrained individuals is that the amount of insulin that is being produced at rest is being produced in a cyclical manner. So my arrow went up and down, indicating that insulin release is pulsatile. The pulse duration is generally right about 10 minutes. But what you notice is that the total amount of insulin that is produced with each pulse was much higher in the untrained individual compared to the trained individual. In the trained individual, it looked like the amount of insulin was much lower, and it looked like it did not have pulsatility. Now, I have another talk that is coming up, which is going to describe why insulin release is pulsatile. Why is it cyclical? Why cyclical release of insulin works better. So look out for that. But I wanted to clarify this, that this insulin release is also pulsatile. The reason why it is not looking like that is because the Y scale is compressed in here in order to accommodate the high amount of insulin that the untrained individuals release. When you expand this Y scale, so in other words, instead of 90 being here, you see that these people make less insulin. So this is 35 picomoles. You see that insulin release, even in trained individuals, is pulsatile. The pulse duration, in other words, it's once every 10 minutes or so. So the pulse duration does not change. However, they need to make less insulin in order for them to have insulin signaling. So what was found in the study was that with training, since insulin works better in a 90-minute rest period, the trained individuals had to make less insulin. In other words, the pulse height, the amount of insulin produced with each pulse, was lower compared to the untrained people. That the total amount of insulin that required to be produced to keep their sugar levels in control was far lower in the trained individuals over 90 minutes compared to the untrained individuals. And here is a depiction of their sugar. The untrained individuals had higher sugars and higher insulin levels. What that means is that insulin was less effective in reducing sugars. The sugar levels over 90 minutes were lower in the trained individuals, and they needed a lower amount of insulin to keep their sugars in control. So what I'm demonstrating to you is that endurance and exercise training, you make less insulin because insulin is more effective. Insulin signaling is better because insulin works better. Less insulin is needed. And it is another way of saying that if you want to enhance insulin sensitivity and if you want to reduce insulin resistance, endurance training is good. Now, how do we combine this information and help us understand how synergism is there between caffeine and exercise in terms of fat oxidation and insulin? So that is this different study that was done, again in about 8 individuals in each group. They were divided into a group that were untrained versus a group that was trained. The trained individuals had lower weight, had lower fat percentage, and had better oxygen burning capacity. So in other words, their maximal oxygen burning capacity was higher, which is just roughly an indication that these people are fitter. They can utilize more oxygen to work at a higher workload. So when these individuals were given caffeine at time 0, so caffeine 4 milligrams per kilogram was given, and what was measured was the change in their resting metabolism, their resting metabolic rate. What was found is that the trained individuals who are given caffeine, the resting metabolism, the resting metabolic rate goes up much higher compared to the group that is untrained. And when you integrated all of these changes over the 120-minute period of study, there was a significant increase in resting metabolic rate in exercise-trained individuals who had consumed caffeine compared to the individuals who didn't. In other words, who were not trained. They consumed caffeine, but they were not trained. Now, one way to know whether the increase in resting metabolism was as a result of fat burning is to measure what is called RQ, or respiratory quotient. As the respiratory quotient falls, it's an indication that you're more fat burning. An RQ of 1 indicates that you're burning predominantly carbohydrates. As the RQ comes down to 0.7, it indicates that you're predominantly burning fat. So if exercise-trained individuals who consumed caffeine, if their RQ dropped more, that's an indication that they became more fat burning. So you can see that the drop in RQ in exercise-trained individuals with caffeine was much greater than the untrained individuals. Now, what about insulin and sugar? A consistent response here is that the insulin levels in the trained individuals were lower to begin with compared to the untrained individuals. And with caffeine, they did not increase. There was a slight bump in the beginning, but then overall the trend was the same. Also, you can see that in the trained individuals, in response to caffeine, the glucose levels did not go up. In fact, there was a slight drop in the beginning, followed by stability in glucose levels. So what that is indicating to you is that neither insulin increases with caffeine in trained individuals, nor does the sugar, and generally these levels are lower compared to the untrained individuals. So to make it redundant, insulin is lower and does not increase with caffeine, glucose is lower and does not increase with caffeine. Now, one hallmark of taking caffeine is that it increases the levels of epinephrine, which is the fight or flight hormone. An amazing aspect of this was that epinephrine levels went up more in trained individuals. In other words, there was a larger increase in the fight or flight hormone in individuals who had endurance exercise training compared to those who were not trained. And again, when you look at the integrated response in terms of picomoles over 120 minutes of the study, the amount of epinephrine that was released in terms of picograms was much greater in the trained than in the untrained individuals. Now, the increase in epinephrine was there, but it did not impact their heart. The reason I say that is that despite a larger increase in their epinephrine, these individuals had a lower heart rate before 4 milligrams per kilogram caffeine was given. And with the administration of caffeine, even though the heart rate went up, it didn't go up that much. Now, in the untrained individuals, the epinephrine did not rise, and the heart rate really dropped just a little bit. One of the actions of releasing epinephrine is the fight or flight hormone. It's the adrenergic hormone. It mobilizes fatty acids. That's one of the mechanisms that I discussed previously about how caffeine mobilizes fat into our bloodstream. So with the increase in epinephrine, there was a lot greater mobilization of fat into the bloodstream in the trained individuals compared to the non-trained individuals. And if you look at the amount of fatty acids released in response to caffeine, and you do an integrated response over 120 minutes, it was a lot greater in trained compared to the untrained individuals. Now, this is another important aspect of a hormone, which is called norepinephrine. Epinephrine is one of the fight or flight hormones. Norepinephrine is similarly another part of the same response. It's a cousin of epinephrine. However, there are differences between the two hormones. Norepinephrine is a vasoconstrictor. It constricts the blood vessels and hence increases the blood pressure. Epinephrine, on the other hand, increases the heart rate, increases fat mobilization. So you don't want norepinephrine to go up, because if it goes up, then your blood pressure will go up. What you see is that norepinephrine did not go up in the trained individuals. In fact, it fell. It fell, whereas in the non-trained individuals, the degree of fall was not similar. So even though caffeine on one hand with epinephrine is increasing the heart rate and may increase the blood pressure, on the other hand, by dropping norepinephrine levels, it's lowering blood pressure. So the net effect of caffeine is perhaps not very much on changes in your blood pressure, which is a good thing, because I, like you, really enjoy a cup of caffeine. Now, in this group, these people were exercised for about 20 minutes at 60% of their maximum oxygen burning capacity. What happened when that was done? When they were exercised at their maximum oxygen burning capacity, the trained individuals, after a period of time, there was a slight reduction in insulin. But look what happened at the end of exercise. There was a sharp reduction in insulin levels in trained individuals. And when insulin levels are reduced, that's when you're going to mobilize the fat. Sugar levels did not change, which is a surrogate indication. It's an indirect indication that caffeine spared sugar in exercise-trained individuals. The question is still left. What is the synergism between fasting plus exercise for fat oxidation? So in other words, if you're fasting and you exercise, is there evidence that you're increasing fat oxidation? So this is a study, and I have listed the paper out here, in a small number of healthy individuals who were fasting overnight. They were subjected to 120 minutes of endurance exercise. And there were 3 different intensities of exercise. One was at 60% of their maximum oxygen burning capacity, another one was at 50%, and the third one was at 40%. The higher the intensity of exercise, the more the fat was mobilized, the more the ketones were produced. The more the glycerol was used to convert to glucose, the sugar levels dropped the most in the group that exercised at the highest intensity. But look what happened when they stopped exercise at 120 minutes and they were observed for another 3.5 hours. The amount of ketones rose exponentially after exercise if you don't eat, especially if your intensity of exercise was higher. Fat burning continued and remained high over baseline levels for that entire duration. Your sugar levels did not drop. What this indicates is that exercise in the fasted state for people who are metabolically unhealthy, who want to burn fat, who want to improve fat oxidation, who want to improve their ketone body production, is perhaps one of the best things for us to do to optimize our health. So how do I put this together? So let's say you have come to a weight stall. You're doing all the practices that we are talking about of low carb diet and your weight is stalling. That despite following the guidelines of the low carb community, that your triglycerides remain high, that your blood pressure remains high, that your diabetes is not coming under control. I think that the central problem that we see out here is what we call as adipose tissue, fat tissue insulin resistance that has not overcome by the practices that you're doing. The fat cells are full, they are inflamed, they are insulin resistant. And in order to repair your adipose tissue, perhaps the best thing for you to do is to optimize the fasting, the low carb diet, the exercise, and caffeine in the way I suggested, which is 1, to do 18-6 or perhaps even longer fast, depending on how metabolically unhealthy you are. To restrict carbs to the degree based on your metabolic health. To exercise in a fasted state and not eat for several hours after exercise. And before you exercise, use caffeine to increase your epinephrine levels so that you get the energy to exercise, and also use caffeine to mobilize the fat that you're going to burn with exercise and convert to ketones. So I know that I have used a lot of liberty based on my clinical experiences to make inferences about what exercise and caffeine and low carb diet and fasting is doing. But this is based on robust amount of clinical experience in treating patients over 7 years. And I want to leave you with a message that if you value what I am doing and you would like me to do more of this, please refer people to IDM Houston so that my work is more channeled towards nutrition and fasting and exercise. And please share, subscribe, and spread the visibility of my channel. Thank you.